It's become an all-too-common scene on the streets of Buenos Aires. Healthcare workers demanding better wages in the middle of the second wave of the pandemic. Carolina CACERES says everyone's exhausted.
We really can't take any more. In this second wave of infections, nurses are at the front when it comes to the pressure of being put on the public health system in this pandemic without sufficient salaries and without recognition. Today, a nurse is paid below the level of the basic food basket. It's an outrage.
Infections are on the rise once again in Argentina. Deaths from the virus neared 60,000 on Wednesday, and there is an average of around 28,000 new infections every day. The P1 or Manaus variant is already circulating in many jurisdictions in the country. Health Minister CARLA says this is the worst moment of the COVID pandemic for Argentina.
This is the riskiest time since the beginning of the pandemic, because even though we have a stronger health system, even though we have health workers who are vaccinated, we also have an increase in the number of cases, which threaten to overwhelm the health sector. And we have concerning strains circulating, which raise the risk of infection and death.
Last week, Argentina reimposed restrictions to prevent the spread of disease. There's a curfew in place from 8 o'clock in the evening and a suspension of school classes in many areas in the province of Buenos Aires.
Last year, the government imposed one of the strictest lockdowns in the world, and because of it, experts say the country prevented its healthcare system from collapsing. The situation is different this year. The government is trying to prevent the economic consequences caused by a total lockdown. And that's why this time, experts are concerned that the healthcare system could be compromised.
It is difficult to know whether the measures are enough. All decisions are difficult. If we don't shut down everything, we'll have to extend the restrictions again and then again like last year. It would have been better to do a strict lockdown. This is what we will have to do until we have enough vaccines.
Like most developing nations, Argentina is struggling to access vaccines to inoculate the population. So far, around 6 million doses have been applied in a country of 48 million, among them Russia's Sputnik V and China's Sinopharm. Much more are needed to prepare the population for the difficult months ahead. Teresa, Al Jazeera, Buenos Aires.